Hi everybody, and welcome back to my channel. We are in a new location today rather than on the floor in front of my bed. We are at my desk, and I'm also wearing my glasses because my eyes were getting pretty dry. So a lot of changes today, but if you're new here, welcome. My name is Charlotte. I hope you enjoy this video and go ahead and subscribe to my channel if you haven't already. So today I thought we could just kind of chat a little bit. You could call it a coffee chat, if you will. I've got my caramel iced coffee. That is my go-to Dunkin' Donuts order. And helping the planet with a reusable straw. So I thought we could talk a little bit about why I chose nursing and what some of my goals are with nursing. Currently, I am a rising junior at the University of Pennsylvania School of Nursing. So I wanted to share a little bit about why I decided to pursue this education and what I hope to do going forward. Right now, there are a lot of things that you've seen helping our healthcare heroes. Nurses are currently on the front lines and helping make sure that people are staying safe and healthy. So I just wanted to preface by saying I have never felt so much pride in my choice of career. I chose this career, first of all, because I really wanted to help people, and nurses are clearly helping people every day, especially now. They're putting themselves at risk. They are going to work every day and working extremely long shifts, and all in all are just putting in so much work for the bettering of our community. So I have never been so proud of the people who do what I hope to do someday, and I have never been more excited for this career choice. This has really put things into perspective to me, and rather than make me feel nervous or fear for going into this area of healthcare, I feel grateful that I chose this, and I feel grateful for the opportunities that I've had in order to better my nursing education. First off, I'm gonna go back, rewind to when I was in the pre-K and early elementary school. So I have always wanted to do healthcare. I had a tiny doctor's kit that I would use. I would use it to diagnose all of my stuffed animals, and I had a stethoscope where I would, listen to their heartbeat, and I would just really find joy in healthcare from such an early age. So then when I went into high school, I definitely knew I wanted to do pediatrics because I loved working with kids. I had volunteered at an after-school program, and I had been babysitting children. So I knew that I wanted to work with kids in some fashion in the healthcare field. So when I first went into high school, I had thoughts about becoming a doctor, a pediatrician. And then as high school progressed, I changed those views more into nursing. I think the ultimate reason why I switched from becoming a physician to becoming a nurse was that in nursing, there is such a heavy emphasis on the patient and their family and being an advocate for the patient. And that was something that I really appreciated and was grateful for in this profession. And so that's why I think I changed it a little bit. Plus, I really wanted to have some kind of flexibility in the job that I chose. And in nursing, if you decide on one specialty after you graduate and then you figure out that you're not super happy with it, you can always change down the line. So I enjoyed this aspect because I don't like making decisions in general. So I wanted to make sure that if I chose to change my specialty later on, that it would be possible. I guess that's why I switched to nursing. Plus, I didn't really want to go to medical school and go through that process and residency, all of that. So then I got to college and started nursing school right away. At my school, you apply into the program, so I was automatically starting the nursing curriculum from my first day of college. That choice was solidified for me when I learned more about nurses and just how much they have to be there for their patients. And I really enjoyed the communication aspect of nursing and explaining things to patients, being there for them in some of their toughest times, and helping them as a member of the patient's healthcare team, being that advocate for them and letting other members of that team know what they need, how they're feeling, those kinds of things. So that is why I loved nursing even more when I got to college. I also began to see that nursing is not one linear opportunity like a lot of people might envision. Nursing is not just going to school, getting your RN, and working in a hospital. You can get so much out of it, and you can really tailor your nursing career to what you want to do. So if you're someone who's interested in, maybe addressing the social determinants of health, you can go into community nursing. If you want to work at a school, you can be a school nurse, you can work at hospitals, you can work at care facilities, you can become a nurse manager, you could do more administrative things, you can become an educator. I could literally go on and on, but there are so many opportunities you can do with a nursing degree. You could also go back to school and you could get a master's degree, which is something that I hope to do. You can become a nurse practitioner, or you can get a doctorate in nursing. There are so many things, and that is another reason why I love nursing. You can do so much and milk so much out of the career, and I really think that that is something truly great about this profession that may not be something you can get in other careers. And that's a little bit about why I chose nursing and why I love nursing. I'm just going to tell you guys a little bit about what I am hoping to do with my career, as it's kind of been cemented for me throughout college so far. So I mentioned before that I entered college hoping to do pediatrics and potentially become a pediatric nurse practitioner. But then I actually got involved with neonatal research at a hospital nearby. I also had the opportunity to volunteer at a neonatal intensive care unit at that same hospital. So I got exposed to a lot of this specialty, which is neonatal nursing. And I really found a lot of passion in it, and it was something that I really wanted to do. I wanted to constantly learn more about neonatal medicine and learn more about how to help this population. And so I now can say with more confidence that I'm hoping to become a neonatal nurse practitioner after college. So this will involve finishing up college, these 2 years, getting my bachelor's and my RN, and then going back to school to get an MSN after I've worked in a neonatal ICU for a while. So this is something that I'm really excited about, and I can't wait for where this journey will bring me. I just wanted to let you guys know some of my goals and why I chose nursing. Nursing is such a great profession, and I am so grateful that I have been able to pursue nursing, and I'm so happy that I chose this path back whenever in high school. I hope you guys enjoyed this video. It's a little bit on the shorter side, but I thought I would just kind of explain a little bit more about the profession and tell you a little bit more about my goals and where these goals kind of came from. I hope you guys enjoyed it. If you did, please give it a thumbs up. Comment down below why you chose nursing or why you chose your career. I would love to hear that. If you aren't already, go subscribe. I'm posting new videos on Wednesdays and Saturdays, and you don't want to miss out on those. Don't forget to follow me on Instagram, Facebook, and Twitter. All of those are linked down below in the description. I hope you guys have a great rest of your week, and I will talk to you in this weekend's video.